Hello friends, welcome to my YouTube channel. So today we will continue with the remaining biopharmaceutics and pharmacokinetics related questions discussion. Question number 11. The extent of ionization of a weak electrolyte drug depends on the options are pH of the media and pK of the drug, then oil to water partition coefficient of the drug, particle size and surface area of the drug, Noise-Whitney equation for the drug, polymorphic form of the drug. Here the correct answer is option A, that is pH of the media and pK of the drug. The extent of ionization of a weak electrolyte is described by the Henderson-Hasselbalch equation, which relates the pH of the solution to the pK of the drug. Next one, the rate of drug bioavailability is most rapid when the drug is formulated as a. The options are controlled to release product, hard gelatin capsule, compressed tablet, solution, suspension. Here the correct answer is option D, that is solution. Because in the solution, the drug is already in the dissolved form. Okay, because a drug in solution is already dissolved, no dissolution is needed before absorption. Consequently, compared with other drug formulations, a drug in solution has a high rate of bioavailability. Question number 13. The amount of drug that a transdermal drug delivery system delivers within a 24 hours period depends on the options are patch composition, which includes an occlusive backing and an adhesive film in contact with the skin, affinity of the drug for the formulation matrix relative to its affinity for the stratum corneum, rate of drug partitioning and or diffusion through the patch to the skin surface, surface area of the patch, all of the above. Here the correct answer is option E, that is all of these statements are true or all of these statements are right regarding the transdermal drug delivery system. Drug delivery from a transdermal drug delivery system depends on all of the factors cited, that is, on the presence of an occlusive backing. This occlusive backing is to maintain skin hydration and elevate the skin temperature slightly, and an adhesive film to maintain the contact of the formulation matrix with the skin to enable drug transfer from the patch into the skin. If the drug's affinity for the formulation matrix is greater than its affinity for the stratum corneum, the drug's escaping tendency from the patch will be reduced, thereby minimizing the gradient for drug transfer into the skin. Then the microviscosity of the formulation matrix, the presence of a membrane between the drug reservoir in the patch and the skin surface, and the interaction of the drug with the formulation matrix affect the rate and extent of diffusion and or partitioning of the drug through the patch to the skin surface. Finally, the extent of drug delivery from the patch is directly proportional to the surface area of the patch in contact with the skin surface. Creatinine clearance is used as a measurement of. The options are renal excretion rate, glomerular filtration rate, active renal secretion, passive renal absorption, drug metabolism rate. Here the correct answer is option B, that is GFR or glomerular filtration rate. A substance that is used to measure the GFR must be filtered but not reabsorbed or actively secreted. Although inulin clearance gives an accurate measurement of glomerular filtration rate, creatinine clearance is generally used because no exogenous drug must be given. However, creatinine formation depends on muscle mass and muscle metabolism, which may change with age and various disease conditions. Question number 15. The earliest evidence that a drug is stored in tissue is. The options are an increase in plasma protein binding, a large apparent volume of distribution, a decrease in the rate of formation of metabolites by the liver, an increase in the number of side effects produced by the drug, a decrease in the amount of free drug excreted in the urine. So here the correct answer is option B, that is a large apparent volume of distribution. A large apparent volume of distribution is an early sign that a drug is not concentrated in the plasma, but it is distributed widely in the tissue. An increase in plasma protein binding suggests that the drug is located in the plasma rather than in the tissue. A decrease in hepatic metabolism, an increase in side effects, or a decrease in urinary excretion of free drug is caused by a decrease in drug elimination. Moving on to the next question. The intensity of the pharmacologic action of a drug is most dependent on the options are concentration of the drug at the receptor site, elimination half-life of the drug, onset time of the drug after oral administration, minimum toxic concentration of the drug in the plasma, minimum effective concentration of the drug in the body. Here the correct answer is option A, that is concentration of the drug at the receptor site. As more drug is concentrated at the receptor site, more receptors can interact with the drug to produce the pharmacologic effect. The intensity of the response increases until it reaches a maximum. When all of the available receptors are occupied by drug molecules, additional drug does not produce a more intense response. Question number 17. Drugs that show nonlinear pharmacokinetics have which property? The options are: a constant ratio of drug metabolites is formed as the administered dose increases, the elimination half-life increases as the administered dose increases, the area under the plasma drug concentration versus time curve increases in direct proportion to an increase in the administered dose. Both low and high doses follow first-order elimination kinetics. The steady-state drug concentration increases in direct proportion to the dosing rate. So here in the question they have asked us that which of the following statements is a property which is shown by nonlinear pharmacokinetics? So here the correct answer is option B. That is, nonlinear pharmacokinetics is also known as zero order kinetics. It is a term used to indicate that first order elimination of a drug does not occur at all drug concentrations. With some drugs such as phenytoin, as the plasma drug concentration increases, the elimination pathway for metabolism of the drug becomes saturated and hence the half-life will be increased. The area under the plasma drug concentration versus the time curve of the drug is not proportional to the dose, neither is the rate of metabolite formation. The metabolic rate is related to the effects of the drug. The route of drug administration that provides complete, that is 100% bioavailability is. The options are intramuscular injection, intravenous injection, intradermal injection, peroral administration, subcutaneous injection. Here the correct answer is option B, that is intravenous injection. When a drug is given by the intravenous injection, the entire dose, okay, so the whole dose we have given will directly enter into the systemic circulation. With other routes of administration, the drug may be lost before it reaches the systemic circulation. For example, with first pass effects, a portion of an orally administered drug is eliminated, usually through degradation by liver enzymes before the drug reaches its receptor sites. Next one, the loading dose of a drug is usually based on the options are total body clearance of the drug, percentage of drug bound to plasma proteins, fraction of drug excreted unchanged in the urine, apparent volume of distribution and desired drug concentration in plasma, area under the plasma drug concentration versus time curve. Here the correct answer is option D, that is apparent volume of distribution and desired plasma drug concentration. That is, what do you mean by a loading dose? A loading dose of a drug is given to obtain a therapeutic plasma drug level as early as possible, or we can say that to get the desired plasma drug concentration as early as possible. The loading dose is calculated based on the apparent volume of distribution and the desired plasma level of the drug. Question number 20. The renal clearance of inulin is used as a measurement of. Options are effective renal blood flow, rate of renal drug excretion, intrinsic enzyme activity, active renal secretion, glomerular filtration rate. Here the correct answer is option E, that is glomerular filtration rate. Inulin is neither reabsorbed nor actively secreted. Therefore, it is excreted by glomerular filtration only. The inulin clearance rate is used as a standard measure of the GFR, a test that is useful both in a clinical situation and in the development of new drugs. Okay, so with this question we have completed today's question discussion session. Thank you everyone. Thank you for watching this video. We will continue this question series in the coming sessions.